Everyone. Thank you very much, Dr. Guzman, for that very nice introduction of myself this morning. I'm very pleased to be with you, and as Dr. Guzman said, I'm very grateful to my sponsor, Elanco Animal Health, for making it possible for me to be with you today. And I'd like to, at the outset, thank the organizing committee of the conference for inviting me. This is my first time in Ecuador, so it's very special for me to be with you today. To talk about this topic that I hope will be of importance to you. Now, I'd like to start out by talking a little bit here about the coccidiosis in chickens. Some of you may be very familiar with this, some not so familiar. These organisms, the coccidia, are ubiquitous in all production facilities for broilers throughout the world. I travel many places, and believe me, there's no place that's not facing a challenge of coccidiosis. We have 7 valid species of coccidia in the chicken. These occur only in the chicken. They're species specific, but fortunately, we only worry about 3 of these as the principal ones that affect production of broilers, and that's Eimeria acervulina, Eimeria maxima, and Eimeria tenella. If we can control those 3, really we have most of the work done in terms of control in broilers. Now, each of these species produces a distinctive lesion, which is very helpful to us, not only in evaluation of this disease at the field level and actual production, but also the use of these lesions to evaluate the effectiveness of anticoccidial drugs, even in studies in the laboratory. And I'm only going to show one of these for the sake of time here this morning. This one is probably very familiar to you. These are the lesions generally in the duodenum and the upper portion of the small intestine caused by Eimeria acervulina. And these sort of whitish or opaque plaques that occur almost in a ladder-like formation here. There's nothing else like this in animal health. So those of you who are in a diagnostic laboratory, if you see this, this is a coccidial infection of Eimeria acervulina. No question. There's nothing else like this in the whole area of animal health. There's other distinctive lesions, but we'll leave that this morning so we can move on to some of the other topics. Now, why do we need an effective anticoccidial? Well, firstly, because, as I said, the coccidia are ubiquitous all over the world in terms of broiler production. And secondly, the coccidia remain the largest, I'm trying to get the pointer here, but coccidiosis is the greatest threat to intestinal integrity in the broiler. We think about the intestine of the broiler, a very important organ in the broiler chicken, especially in terms of production efficiency. It's lined with a single layer of epithelial cells, and those epithelial cells are the first point of entry for the coccidia. This is where they like to reside after oocyst ingestion. Now, we know there are direct costs resulting from coccidiosis, and this, of course, is due to the effect on weight gain and feed efficiency, and principally on feed efficiency. But we also know that there are indirect costs because coccidiosis, even at a fairly low level of infection, is a precursor to necrotic enteritis. The reason for this is because when we have a coccidial infection, we have a development of a local immune response, and mucus from this response is produced in the lumen of the intestine by the chicken as a defense mechanism. But it turns out that that mucus is the perfect growth medium for Clostridium perfringens, the causative agent of necrotic enteritis, and therefore it becomes a problem in terms of overgrowth and toxin production. Of course, necrotic enteritis is a very important disease. We don't have time to discuss that at length this morning, and I think there are perhaps other papers in the Congress addressing that particular disease. But the important thing here is that we need to control coccidiosis in order to help to prevent necrotic enteritis. Now, the principal reason that we need an effective anticoccidio is because the coccidia have a very, very high reproductive rate. A single oocyst ingested, if the bird is not medicated, will give rise to hundreds of thousands of additional oocysts. Now, this is an evolutionary change that's taken place with the coccidia in their coevolution with chickens starting thousands of years ago with jungle fowl, where the likelihood of oocyst ingestion was actually fairly remote. Now, of course, the likelihood of oocyst ingestion is very high because of concentration in broiler production. But to compensate for this in an evolutionary way, the coccidia developed asexual divisional stages after oocyst ingestion. And we see in this right panel one of these, and these are called the schizonts, and they contain hundreds of merozoites, again, an infective stage. And one of these, with hundreds of these merozoites, resulted from just a single ingestion of a sporozoite from the oocyst. So you can see the very, very large buildup of oocyst production through this asexual division, as you see in the right panel. In the left panel, of course, are the oocysts, which are produced in thousands, again, from a single oocyst ingestion. The other important point here is this is a scanning electron micrograph. In the right panel here, these are very, very small organisms, the merozoites, but you can see that it has burst open a cell in the epithelial tissue of the chicken in the intestine. And this, of course, is the damage that results in, first, in feed efficiency loss and eventually in loss of production efficiency altogether. Now, this is a graph that is actually quite familiar because it's been published for many years in the publication Diseases of Poultry. It is a graph of the development of the anticoccidial industry or anticoccidial development in the U.S. Over the years from 1945 out through 1995 here. And it's plotted against the annual production of broilers in the U.S. in those years in billions. I don't want to spend a lot of time, and I can't spend a lot of time on this slide, except to show you that almost every year or two there were new anticoccidials that were developed and introduced in the U.S. market. The reason for that is that all of these were synthetic anticoccidials against which the coccidia developed resistance very rapidly. And a big breakthrough came in 1971 with the introduction of monensin or Coban or elancoban in some areas of the world. And we're going to talk more about that because that really transformed the broiler industry. And you can see this very rapid growth of the broiler industry after this first discovery of the ionophores. Now, this slide is finished here in 1995. It's 20 years out of date. The reason for that is we've had no new anticoccidials introduced in the USA since 1995, so some 20 years ago. And if we then took this production up to where we are at present, it would be about 12.5 billion broilers per year produced in the USA. So when we talk about the synthetic anticoccidials, as we showed in that graph, the development started in the 1940s, and over the ensuing 20 years, we had many new anticoccidials that were introduced into the industry. All of these were, again, synthetics. They're sometimes called chemicals. We generally use the term chemical in the industry for these to distinguish them from ionophores. But unfortunately, the coccidia fought back very rapidly and developed resistance to essentially all of these, some in a very, very rapid way. And in the last point here, sometimes that resistance was so abrupt, developed so rapidly, that unfortunately the sponsor of these, the sponsoring animal health firm, wasn't even able to recoup their development costs before these anticoccidials were rendered ineffective in the field because of drug resistance. Kind of an unfortunate history. Now, I told you that one of the real breakthroughs in the control of coccidiosis was the discovery of menencin, which is the active component of Coban or elancoban. And this was discovered in 1966 in the laboratories of Eli Lilly and Company in Indianapolis. And I must say this was a very fortunate discovery because it was discovered from a soil sample, fermentation of a soil sample from the state of Arizona in the USA, completely unlike the synthetic anticoccidials that we knew about up to this time, because menencin and other ionophores are produced through fermentation in very large fermentation tanks. They've never been synthesized by even the brightest chemists in the world have not been able to synthesize these. And menencin was first approved and first introduced at the Poultry Science Association meeting in Fayetteville, Arkansas in 1971. And it became so popular that it was under allocation fairly quickly because it was adopted so rapidly by the broiler industry. Now, when we look at menencin, it's important to talk about the mode of action because the mode of action of the ionophores is, again, unique, quite different than any synthetic anticoccidial, and has been very interesting in the development and use of ionophores. And so I'm illustrating this with menencin, although what I'm talking about here is common with all ionophores. And if we look at the structure as we'd see, say, in a chemistry book, as flat on a piece of paper, this is the structure of menencin. As I said, it's a complex structure, never been synthesized by man, only by Streptomyces cinnamonensis, the soil fungus that produces this particular ionophore. But the important way to look at ionophores is in a three-dimensional way. This is the three-dimensional structure of menencin. And ionophores are called ionophores because the term means ion bearing or ion transporting. And what they all have in common is that they trap an ion, and in most cases this is a sodium ion, within a molecule of the ionophore. And so here we see menencin, a three-dimensional structure, one ion sodium trapped within one molecule of menencin. The other important point about the ionophores is that they like to become incorporated in bilipid membranes. And in a bilipid membrane, they transport that ion across the membrane. And it turns out, and again, this was really quite by chance, that the membranes of the sporozoa, this is the initial entry for coccidia in the chicken, the initial invasion is the sporozoa. The membranes of that are a bilipid membrane. There are two membranes, and between the two membranes there is a lipid layer. And of course, none of this was known at the discovery of menencin, but subsequently was found through some very important mode of action studies. Now, what I show to illustrate that here is really three parts of a photograph here. This is in the very background here is a fixed and stained at high magnification villus in the intestine of a broiler. And here you see a sporozoite that is just invading one of the epithelial cells in the villus of the intestine. Up here in the left panel, you see a mass of these sporozoites. And again, this is a very high level of magnification because they're very small organisms, some 2 microns in diameter and some 7 microns in length. But this shows a mass of these in the lumen of the intestine after excistation, after they've escaped from the oocyst in the lumen of the intestine. And down here in a transmission electron micrograph, this is a 6,000x magnification. We show the illustration of how the ionophores work. They become incorporated in this bilipid membrane of the sporozoite. And as in that situation, they are transporting their trapped ion into the sporozoite, and they're picking up another ion of sodium out in the lumen of the intestine. Well, the coccidia are endowed only with a limited amount of energy, because this energy is to be used to invade a cell of the chicken for nothing more than that. And this is in these glycogen reserves, which through glycolysis, these then produce energy to power what we call a sodium-potassium ATP, or sodium pump, to pump this excess sodium out of the sporozoite. It doesn't want the excess sodium there, because this is going to produce an osmotic imbalance. What happens then is that because they have only a fixed amount of this energy, the sporozoite runs out of energy, and we do have a lethal osmotic imbalance. This again is electron micrographs. These are now scanning electron micrographs at about, a 6,000x magnification. And on the left panel here, we see a normal sporozoite of coccidia in a very high level of magnification. And in the right panel, we have one that has been treated with an ionophore. And you can see the swelling. This is due to the fact that when you have this excess of sodium that can't be removed, then you have water entering the cell, and you have a classic osmotic imbalance. And if you study this under the microscope, you can actually see these sporozoites explode. And this is what is the lethal damage of the ionophores. Now, I should say that the discovery of monensin was probably the most important discovery that has taken place in terms of anticoccidial chemotherapy. One of the most important discoveries in all of animal health. The reason for that is because if there wasn't the discovery of monensin, there would be no other ionophores, because after this discovery, then, as would be expected, other pharmaceutical companies and their animal health firms looked for additional ionophores, because they knew that this might be an avenue to development of a new anticoccidial. And so as a result of that, we now have 6 ionophores that have been approved for use in the USA. And I show here the chronology of the year of first approval. And as I said, the last of these is cemdiramycin, which was approved in first use in 1995. So importantly, 20 years since the last anticoccidial has been introduced in the US industry. And yet we've been going on with very, very efficient broiler production. And the reason for that is because the unprecedented longevity of these ionophores due to the lack of resistance development like we had experienced previously with synthetic anticoccidials. In the right panel here, you see the various use levels, approved use levels of the different ionophores. And from this, you can see that they differ in their potency, but this is accounted for by the use level in final feed. And in most cases, in every case other than cemdiramycin, these use levels are a range clearance, or a range of levels that can be used. And this is very, very useful to the broiler producer, because they can adjust the level of the ionophore based on the challenge of coccidia in their production. Now, there are several really important points here about the use of ionophores, and this one I'm trying to illustrate in this slide, I think, is the key one. Although ionophores differ in their chemical structure, from the standpoint of the coccidia, if you were a coccidia, they all look the same because they all have the same mode of action, and therefore, the activity of the ionophores, as we know, is dependent on a direct uptake of the ionophore in the lumen of the intestine against the invasive stage of the coccidia, whether that be a sporozoite or whether it be later on one of those merozoites. It's due to a direct uptake. And the most important point of that is that the ionophores, to be effective, they have to be in the feed continuously. Once you withdraw the ionophore from the ration, for example, in a withdrawal ration, your protection is completely gone. In fact, if we look at the passage time of most rations, say 5 to 6 hours, if we redraw the ration 5 to 6 hours later, that bird is highly susceptible to coccidiosis. So we have to keep ionophores in the feed all the time. Now, how do we account for the long-term success of the ionophores? Well, I think it's because of the unique aspect that ionophores prevent clinical coccidiosis, but they don't prevent subclinical coccidiosis. So the coccidia, a few of those coccidia always escape the activity of ionophores. They go on and develop as if there was no problem, and there isn't any problem once they get inside a cell of the chicken, because once they're inside the cell of a chicken, they're protected from the ionophores. So they go on and develop, and in doing so, they provide the perfect basis in the subclinical development for the development of immunity to coccidia on the part of the bird. And this, I think, has been the principal reason for the long-term success of ionophores, because they create what is essentially a perfect balance between the coccidia, allowing a few of the coccidia to reproduce, and the chicken by protecting it against the clinical aspects of coccidiosis. Now, another important discovery which came later on was the synergistic potentiation of ionophores. And this was the discovery that a combination of nericin and nicarbazine, the synthetic nicarbazine, was synergistic against the coccidia, and this resulted in the development of a new potentiated anticoccidio-maxiban, which has been used principally in a shuttle program, at least in the US. Maxiban is used in the first, through the first grower ration, sometimes even in the second grower ration, and always followed by an ionophore in a shuttle program. And I have to say, when you look at AgriStats, which is our reporting system for the use of anticoccidios, that at the present time, Maxiban is certainly one of the most widely used anticoccidios in the US and likewise in other parts of the world. So this was quite an interesting discovery, because this is the only truly synergistic anticoccidial combination that has been discovered in many years. Now let's switch here to immunity to coccidiosis and the use of coccidiosis vaccines. This could be another whole lecture, and I'm only given 45 minutes here with you this morning, and I'd love to give you a lecture on immunity to coccidiosis. Unfortunately, I won't have time to do that this morning, but it is an important area because this currently is the only alternative, really, that we have to anticoccidial chemotherapy in terms of control of coccidiosis. There are no other alternatives as long as we're raising the birds on litter, because we're always facing a challenge of coccidia. Now, there are some pretty important points about the use of coccidiosis vaccines that we need to take into account here, and they all have to do with the immunity to coccidiosis in chickens. They all have to do basically with what we understand about that immunity. The first of these is that immunity only results when we let the infection go to the asexual stages, and these, of course, are the damaging stages of coccidia. This is unfortunate, but it's due to the fact that the sporozoites, that first invasive stage, do not impart any immunological response. They don't express immunologically protective antigens against coccidia. Perhaps the reason for this is because they have some proteins that mimic actually some of the same proteins in the chicken. I mean, we don't know about this, but we do know they don't impart immunity. So we have to let this go to these asexual stages. Beyond that, we have the problem that complete immunity requires repeated infections from further ingestion from the litter. In other words, the first exposure with, for example, administering a coccidiosis vaccine in the hatchery does not impart protective immunity. We have to have repeated exposures from the litter, and this is again one of the issues we have to deal with. Thirdly, this immunity is species specific, so we can have a bird that's completely immune to Eimeria acervulina. It will have no immunity to the other species, so it's very species specific. This we have to be aware of. And beyond that, one of the species, Eimeria maxima, typically has immunological variation within it. Now with the coccidia, we don't deal with the kind of variation that we have with viruses or perhaps with bacteria. We don't have a new strain popping up all the time that negates the value of our vaccine. It's only this one species where we deal with that issue. So the use of these vaccines, I think they are important in many ways, and they can be used effectively, but we have to realize that there is some risk of infection because we frankly have to have an infection in order to get immunity. And again, that risk is not only a vaccine reaction, but also this precursor to necrotic enteritis effect that I mentioned earlier. Well, what about management of coccidiosis in the future? I'm afraid that I have to be fairly pessimistic about this this morning. Whenever I'm giving talks, I'm quite pessimistic about this because there are no new anticoccidials on the horizon. I already illustrated that we're 20 years from the last of these ionophores being introduced as an anticoccidial. The reason for this, ironically, is because of the success of the ionophores in controlling coccidiosis. You remember that graph that I showed you, every couple of years there was a new synthetic. The reason for that is because the previous synthetics failed. The ionophores, because of their long-term success, have caused animal health firms to focus on other unmet needs. And the costs of discovery and development of a new animal health product of any sort is quite substantial. So they're focused away from the area of coccidiosis and focused more in terms of discovery to other unmet needs in the poultry industry. And I'm sorry that sounds fairly pessimistic, but I have to be honest with you this morning that I don't see new vaccines or new anticoccidial products coming on the market anytime soon. So what do we do with what we have? And that's what we really have to consider in the long term here is how do we use best what we have. And these are just general recommendations based on my work with the poultry industry for many years. The first is I believe that ionophore-based programs are the best programs in the long run because of their consistency and because of their long-term success. When we're using chemicals, and I don't want to say that chemicals have no place in anticoccidial chemotherapy, but we need to be careful that we don't overextend the use of them to get into a resistance problem. And that's why I always encourage broiler producers to keep a very good chronology, a history of the synthetic or chemical anticoccidials that they've used, so they don't return to those too quickly and then be faced with a very serious resistance problem. So one has to be very careful in programming chemical use and keeping a very good history of what you've used. We shouldn't extend the use of blank feed, and when I use the term blank feed, I mean withdrawal rations, because again, with ionophore-based programs, we know that once the ionophore is gone, I like to think of anticoccidials as an insurance policy. Once the ionophore is out of the ration, the insurance policy is gone. There's no more insurance. So I always recommend to feed the anticoccidial up to as close to slaughter as one can. Of course, you have to adhere to whatever the regulatory requirements are in terms of anticoccidial withdrawal. But I like to recommend feeding as close to slaughter as possible because you already have a major investment in the bird and why throw away that investment sort of at the end of the grow out. And we already talked about aspects of the coccidiosis vaccines. We just need to bear in mind that we are going to have repeated infections. We can control this. I mean, we can do this quite nicely, but bear in mind that each one of those is proceeding to a subclinical coccidiosis state. And the big culprit in that situation is necrotic enteritis because of this sort of precursor effect. Well, Dr. David Chapman and I, Dr. Chapman's at the University of Arkansas, and he co-authored with me my paper in the proceedings for this Congress. He and I have been working on a concept of actually using vaccines, coccidiosis vaccines, and anticoccidials together to help sustain the long-term viability of the anticoccidials. And the basis for this is that coccidiosis vaccines contain only drug-sensitive strains of coccidia. Some of these have been in the laboratory for many years prior to the introduction of any of these modern anticoccidials. So when we use these vaccines, the progeny of those vaccines, the oocysts they produce, are truly drug-sensitive. And we know, this is based on a recent paper that Dr. Chapman and I had in the International Journal of Parasitology, where we put forth this concept that we know we cannot, in fact, eliminate the coccidia from any broiler facility. This is impossible, even with the best cleaning that we can do. We know we cannot accomplish that, but we can, in fact, change the genetic structure of that population through the use of one of these drug-sensitive vaccines. This is a program that, frankly, is being evaluated by some of the broiler producers in the US right now. I can't tell you what the eventual outcome will be, but they, of course, will be able to tell the eventual outcome because they measure the results very precisely, as you know, as you do, and many, many thousands, if not millions of birds. So they'll be able to tell us the answer. So at closing here, I'd like to thank all of you because I'm looking around, I don't see anyone who's sleeping, so I thank you for your attention to my talk this morning.